Really, when we kind of got wind of AVN, I was desiring to try for basketball. And I went to the workouts, tried out. Obviously, I had complications during the workout. I did not want to listen to my mom being cautious or saying that I didn't need to do it or any of that. Went to the workouts, got through the workout, came home, said to my mom, "Mom, I feel crunchiness in my hip." She didn't know what I was talking about. We notified our hematologist the next day, and then he connected us with someone in the medical field that gave us the news about avascular necrosis.
I was recently diagnosed with avascular necrosis. It has impacted me by limiting my mobility and some of my independence. Specifically, now my parents help me out a lot with supporting things such as walking, and also the use of a walker is sometimes needed to help with that mobility.
As far as mobility goes, in regards to how it affects me, I obviously have limitations. Can't walk for long distances without, obviously getting tired and having fatigue within the hip. Also, I have an obvious limp when I walk. Generally, if I'm dealing with any kind of pain, it is always joint related, and I kind of always deal with some kind of pain in my hip. But I have an incredible support system, and they have helped me thus far, and I have faith they will continue to help me as well.
The first difference that I noticed was a limp in my right hip. I was not proactive, but should have been and notified my doctor in advance, as there could have been additional treatments available.
What I see really making a difference in these patients as it relates to pain control is complementary pain techniques. Physical therapy has helped change how AVN is managed in these sickle cell disease patients. These kind of interventions have helped patients reduce or eliminate the need for surgeries. Physical therapy interventions are not meant to be alternative, but rather complementary to pain medications and other medical management. One of the most important things to remember is the sooner that you can implement these interventions, the better the outcome.
It's very important to educate yourself. You should be aware of what's going on in your body as well. So the more you educate yourself, the better you'll be in the long run. Sickle cell obviously affects my ministry, it affects my life, but that is not the end all be all. Even though you have sickle cell disease, you still have purpose. You still have a reason to get up. You still have a reason to keep going. You still have a reason to experience life. I never thought I would be married. I never thought I would have children, but I obviously do have both. I never thought I would have a flourishing career, but I have that as well. And so you don't have to just accept the reality of having sickle cell disease, staying in the bed, doped up on pain meds all day and waiting on a check. You can get up and be somebody if you make a conscious decision to do so.
All of my patients inspire me every day. With all of the changes in their body, their joint pain, their chronic pain, their joint changes, and I am just inspired and glad to be a small part of their treatment team that can help them to make their life better and a little more comfortable and functional.
So my outlook for the future is still bright. My plan of action is to get a hip replacement, to continue in my career, to continue investing quality time with family and friends, and just living life.